also, the Chief Medical Director of Nnamdi Azikiwe University Teaching Hospital, Nnewi, Professor Joseph Ugboaja, is joining us now in the studio to give more insight on the transformation being experienced at the teaching hospital. Many thanks for joining us, Prof.
Yeah, thank you, thank you, viewers, and welcome to the program.
All right. Now, Prof, what exactly would you say the University Teaching Hospital is doing differently that is attracting Nigerians and perhaps bringing the needed relief to patients?
Thank you. We are not doing anything different. What you see happening at the teaching hospital at Renewal is happening in almost all the teaching hospitals and federal tertiary health centers in the country. And what we do is very simple. We are leveraging on the sector-wide approach by the ministry, representing the Renewal Hope agenda. You see, for the first time in a very long while, we have in this country a president who has understood health for what health is and has prioritized healthcare for this country. And so not only by word of mouth, but by actions. Now we are witnessing increasing funding in the healthcare. So we're witnessing a total transformation of the sector by the president, Bola Ahmed Tinubu. And one major strategic move he took was the appointment of the coordinating minister, which is Professor Ali Pate Mohammed. So that singular action by the president has totally transformed the health space. So what we are doing now, what you see happening at the Nnamdi Azikiwe University Teaching Hospital that has, engendered wide international, attention and all of that, are also happening at other federal tertiary health and say it's a sector-wide thing. And I will tell you what it is. What it is simple. What it is that at the hospital, we are encouraged and burdened by the disposition of the current administration towards improving health sector and towards giving Nigerians access to equitable, affordable and quality health care. And of course, by the program of the ministry. And so that is what we have done. We have aligned completely our processes alongside what the ministry is doing. You see, I came on board in 2021 as the CMD. And then we had a vision, and our vision was to rank among the top 3 hospitals in the country.
Fantastic, CMD. Now, you know the challenges our health sector is facing. How have you been able to ensure better healthcare service delivery in spite of these challenges?
Okay, thank you. Again, what we've also done is to align completely with what the federal government is doing, the Renewal Hope agenda of Mr. President, looking at Mr. President's disposition towards giving Nigeria quality health care. And then, of course, leveraging of what the ministry is doing under the able leadership of the coordinating minister. And so our vision was backed by 9 pillars. And those 9 pillars, we aligned completely alongside the pillars of the Nigerian health sector renewal investment initiative. And so we already had a roadmap from the ministry. We also have a roadmap from the presidency, and that is what we are following. The first in the list of the pillars is infrastructural development. Okay, so when we come on board, we were the old side. Our old side was very small, and then we said what we're going to do. Of course, the vision cannot take place at the old site. Necessarily, we have to develop the permanent site. So what you're seeing at the permanent site is a product of what has happened. And so infrastructural development was one of the pillars, and we follow through. We have the human capital development pillar, which is also aligned critically with one of the pillars of the Nigerian health sector renewal investment initiative. And under the human capital pillar, what our objective? Our objective is to recruit Nigerians we know, even non-Nigerians we know, that have the capacity to drive the vision. Recruit them, train them, and retain them. And of course, we know that we are threatened by the Japa syndrome. So we have a homegrown solution to all of that.
Fantastic, Prof. We need to let you go, but just the last question. How relatable are your services to Nigerians in line with the national reform and, of course, the renewed hope agenda of the current administration?
Yes, all we are doing at Nnewi, like I said, Nnewi is just a model for the people to see. What we are showing is that the reform agenda of Mr. President and, of course, the initiative of the ministry is working. And what is the major objective? The major objective there is to ensure that Nigerians have access to quality, and affordable healthcare and equitable distribution of resources. And that is what we've been able to do. So all the success we've achieved as a result of the support we're getting from Mr. President, and of course the support of the coordinating Minister for Health and Social Welfare, Professor Ali Pate Mohammed.
Great. We hope that you keep up the great work. Many thanks, Professor Joseph Ugboaja. Thank you for joining us.
Thank you very much.
All right. We've been speaking with the Chief Medical Director of Nnamdi Azikiwe University Teaching Hospital.